Good morning. I'm Councillor Lucy Hobbles, the Chair of the Health and Wellbeing Board. This virtual meeting is taking place on the 24th of November 2020 and it's being recorded live to the Council's website and will be available to be viewed for a maximum of 6 months. I would like to give you a very warm welcome to members, officers and any members of the public or media who are watching this live feed. I will move straight on to the formal meeting and the agenda, item 1, which is apologies. Can I ask Jackie Graham if there's any apologies, please?
Thanks, Chair. We've got apologies from Councillors Allen, from Julie Gillen, Richard Chillery, Steve Helps and Steve White.
Thank you, Jackie. Moves us on to item 2, substitute members. Again, Jackie, we have some substitute members this morning.
We do, Chair, yes. We've got Suzanne Lamb for Richard Chillery, Peter Aitchison for Julie Gillen, Keith Carruthers for Steve Helps and Sharon Cadell for Steve White. Thank you.
Thank you, and a very warm welcome to those to this morning's meeting. Item 3, declarations of interest. Does any member have any declarations of interest before we start the meeting? I haven't been notified. I do believe there's no declarations, so I'll move on to item 4, which is minutes of the Health and Wellbeing Board, which was held on the 11th of September. I'm not aware of any issues, so we can agree those minutes. Okay, moves us on to item 5, which is health and social care integration, which is a standing item on the agenda. And can I ask Jane Robinson and Michael Lang to provide a verbal update, please?
Good morning, Chair. It's Jane Robinson, Corporate Director for Adults and Health. Good to be here this morning. I think at the last meeting I gave an update in terms of both Michael's appointment as the Director of Integrated Community Services and the work that Sarah Burns and her team were doing in terms of integrated commissioning and some really positive progress that's been made in terms of those 2 key areas for us. It's probably timely now, Chair, that we kind of review our kind of governance and our next steps towards integration and really how we kind of strengthen and build on what we've got already and have that particular focus around kind of inequalities and population health management. So that's something that we're looking at the moment and would probably want to bring something back to the board in the new year, Chair, if that's okay. But just want to hand over to Michael in terms of some specific elements he wants to update on, if that's okay.
Thank you, Michael.
Thank you, Chair. Thank you, Jane. As well as the work that we're doing on governance, Chair, there are 2 practical items of integration. So firstly, we are in the process of appointing first contact physiotherapists who will be employed by the Trust and work through the community services team into primary care. And that will really help our primary care colleagues with their new responsibilities and hopefully reduce contact with acute services and admissions to hospital. I think the second piece of work that we're doing jointly between primary care, community services, the Trust and mental health is a pilot to care more effectively for people with long COVID, particularly NHS employees with long COVID. It's a really interesting pilot scheme, and it does take in all of the health and social care services in County Durham and clusters them around those people with long COVID, which is a condition that we're just starting to learn more about, really, Chair. Thank you.
Thank you, Michael. Any questions from the members? I haven't been notified of any questions. Are we happy to note the update? And with that, I'll move on to item 6, which is the framework for good workforce mental health in the county. Amanda?
Thank you, Lucy. I'll give a very brief introduction to this before handing over to Mick Shannon, our Public Health Advanced Practitioner. And I think it's probably very fair to say that I suppose at no other time have our businesses had to really think about mental health, both in terms of through COVID and the impact of COVID. And I'm delighted to be able to present this report today in terms of the work that we've been doing with our businesses, including our voluntary and community sector, to ensure that they have support in place for their mental health. And without further ado, I'll hand over to Mick, who's been carrying out the work with our small businesses, including some very in-depth focus group work, and he'll take us through the report and to the recommendations, Chair.
Thanks, Amanda.
Thank you very much, Amanda. Good morning, everyone. My name is Mick Shannon and I work for Durham County Council's Public Health team. I lead on the Mental Health at Scale programme. And thank you very much for giving me the time to present an outline of the framework for good workforce mental health in County Durham businesses. You will have seen that with the bundle of papers for today, we've actually circulated the framework document itself. Please feel free to refer to that as I go through the report covering its implementation. This work itself has its genesis in the Mental Health at Scale programme and the need to ensure equitable access to good workforce mental health training and support in County Durham businesses, and we say that across the county. If we were to look at existing support, for example, in our large public sector organisations, we are able to avail ourselves to a large suite of mental health, good quality mental health training and support. And we have lots of mental health training. We have an employee assistance programme, or many of us do have. And this a lot of this framework is driven by additional needs that have arisen for smaller voluntary and community sector organisations and small and medium-sized businesses, where they may not have the capacity or resources to commission or provide programmes of this nature. But the framework itself does a little bit more than that. What it does is it gives those who own or run businesses in the county some good evidence and information upon which they can sort of base their decisions and base their work going forward to improve the mental health and well-being of their workforce. Having a parity of esteem between good physical health and good mental health is critically important, as it really helps us improve our sort of general well-being, our productivity, and of course with improved productivity we have improved performance by businesses, and this is so important in terms of not only people's well-being but the contribution to our regional economy. We know what the negative impact of poor mental health and well-being is in workplaces, and it's likely to be bigger for our smaller concerns because they have a smaller staff size. Therefore, if one person is absent in a business which employs 5 people, that's effectively 20% absence rate. One person being absent, of course, from a very large organisation is likely not to be felt as largely as it would be in a smaller organisation. So as Amanda said there, this framework has been developed as a result of some great collaborative work in conjunction with local business specialists, for example, Business Durham, the Federation of Small Businesses. We have consulted with the North East England Chamber of Commerce, and also we've consulted with our local business people and voluntary and community sector representatives and colleagues in order to produce a set of actions that aim to tackle workplace mental health stigma and discrimination and improve general mental health awareness and promote the importance of good mental health. And I refer to stigma there because stigma really is the key issue and often a key barrier to people discussing their mental health. We will all, most of us may be quite happy to talk about any physical ailments that may affect us, but people are still generally less likely to talk about their mental health so freely. As part of this this wider framework, certainly I know the chair's aware of this because you presented on a radio programme promoting these services. Thank you very much for that. We've commissioned and procured 2 key county-wide services for owners, managers and employees of small businesses. We've commissioned an employee assistance programme that can be accessed free of charge by SME and VCS organisations based in County Durham. And we've also commissioned Mind, Hartlepool and East Durham Mind, to deliver very good quality mental health training, again, free of charge for SME and VCS organisations based in County Durham. They've been fully funded for 2 years and they're both now fully operational. However, other objectives within the framework focus on areas such as campaigns, communication, collaborative working between VCS and SME organisations, and also capitalising and maximising the impact and effect of improved awareness of these issues. And more importantly, the framework has been reviewed before general implementation to cover matters that are relating to COVID-19. As Amanda said there, we have identified additional needs arising from the pandemic, many of which are disproportionately borne by our local businesses and voluntary and community sector organisations who have been many of whom have been significantly impacted by the pandemic. We first heard this coming out of Italy when they felt the full impact of COVID-19 in wave one, and people talked about mental health being the emergency within the emergency, and that is indeed the case. As businesses, residents, or populations work hard to reduce the transmission of COVID-19, we are beginning to see more and more that mental health issues emanating from many of these restrictions are coming to the fore. Durham County Council is currently working with other internal and external stakeholders to look at a campaign that we can run across the winter in order to directly address these issues. The framework itself has been developed not only in collaboration with our local stakeholders, but it's based upon solid evidence. Many of our recommendations are based upon the product of the Thriving at Work review of mental health and employers, which was an independent review commissioned by the government and undertaken by two key advocates of mental health, the CEO of Mind, who is Paul Farmer, and also Lord Dennis Stevenson, who is a recognised advocate of mental health, and who coincidentally was chairman of the Newton Aycliffe and Peterlee Newtown Development Corporation between 1971 and 1980. So one of the authors of this report actually has established connections with County Durham. The report takes into consideration the vision for County Durham to 2035. One of the key priorities is creation of more and better jobs, and workplace health and wellbeing has a really important role to play in this. So, in connection with the vision, our vision for mental health and wellbeing in County Durham is to ensure good workforce mental health and wellbeing, and ensure that's a fundamental priority for people in all County Durham organisations, be they the public sector, private sector, or our thriving voluntary and community sector. And our mission is to work with these businesses to reduce mental health stigma and develop access to good quality mental health training and support. So where do we want to be with this then? Well, what the framework intends to do is, and its key action is to make sure that employers are visibly committed to positive mental health. And indeed, we recognise that many business owners and employers may undoubtedly be experiencing issues themselves as a result of the pandemic. We want managers to be informed and to have the confidence to openly discuss or have conversations with staff around their mental health and wellbeing. And we want, importantly, for employees to be self-aware and to have the confidence really to ask for help when it's needed. So how do we get there? I'll refer you to the actions and objectives section of this report. And indeed, the framework itself contains a key set of actions to tackle workplace mental health and stigma and discrimination, and to improve general awareness. I've discussed the two key services that we think will assist us in our aims and objectives to achieve this. But ultimately, having built a strong guiding collaboration with many of our business specialists, I mentioned earlier Business Durham, the Federation of Small Businesses, etc., we want to continue to capitalise on these well-established networks in order to ensure that once this framework is implemented, we can continue this collaboration and continue to promote the importance of mental health and wellbeing amongst not only these business specialists, but their clients and service users who they are working with on a day-to-day basis. What ultimately will this achieve for us then? Well, I did mention earlier that the good mental health and well-being, directly contributes to increased productivity, because happier workers and happier workplaces are more productive. It would directly contribute to decreased numbers of absenteeism from our workplaces. We know that, for example, mental health and well-being is still, unfortunately, one of the key reasons why people may be absent from work. This is very costly to the employee in terms of their health generally, to employers in terms of the cost of running their businesses, but also to the general economy in terms of cost to the economy. And let's not forget the indirect costs of this on our healthcare services and healthcare provision, many of whom bear the costs of treating mental health and well-being issues if they haven't been prevented. We want to normalise the conversation around mental health and well-being, and that in itself will directly reduce the stigma associated with that. But ultimately, we want to make County Durham a safe and healthy place in which to work and live. We want organisations who are powered by people who have the confidence to come to work, to discuss both physical and mental health well-being and be happy in their workplace so that they're motivated, productive and engaged. And I asked the Health and Wellbeing Board to consider the report, to consider the framework itself before we implement and disseminate the framework and do more work with our businesses to see that it becomes a staple part of their considerations towards mental health and well-being going forward. Thank you very much.
Thank you, Michael. Thanks very much. The recommendation at the bottom of the report is to ask to note the contents and the objectives of the framework, and obviously we will feed any feedback to you as well, Michael. As mental health champion, I fully support the work that's been undertaken. The board will recognise that the coronavirus has presented many challenges for our local businesses, and I would like to commend the work that's been undertaken to prioritise mental health of our workforce. I always do say in these meetings, we always have to start at home, and I think this truly demonstrates that. And I thank you for the work that's been undertaken, and I ask the board to note the contents as the recommendation. Does any member wish to speak, Olwen? Councillor Gunn?
Thank you, Chair. Yes, I would like to just support your comments, Chair, and also to say that, as Michael has talked about, the impacts and effects upon people who are in employment, and the impacts and effects he's outlined and described very well indeed. One of the effects, I think, that is very much close to my heart is the effect and the impact of mental health upon families and therefore upon children. And I think these knock-on effects, it's a bit ripple-like in a sense, because it goes outwards. It's not just one person, and it's not just one company or one business. It's actually to do with a whole range of things that occur. So if it's affecting families, it's affecting children, it's affecting the way that children actually go to school and learn. And I think this is actually such a good framework. I'm really delighted, not just in relation to what I've said, but I think that ripple impact is one that we can't ignore at all. It's really huge. But I'm also delighted because all of us, I think, as elected members living within our communities are very much aware of the small business impact and the way in which those businesses have struggled, and some of which are still struggling and tying themselves in the proverbial knot to actually keep afloat and keep surviving. So I very much welcome this, and thank you.
Thank you, Olwen. Michael, did you want to come back? Listen. No? Yeah.
Yes, thank you very
Michael?
much.
Yeah.
Thank you, Councillor Gunn. I think that you've picked up on a very important point there, and this is one which that was in my mind whilst we wrote this framework, is that the literature in respect of mental health is very clear on the subject. None of us operate in isolation. either in our personal lives or our professional lives or in education, it goes without saying that how we are feeling at work or how we are feeling at home will affect everything surrounding that. So we can't switch off when we leave the house and go into work. And equally, it's very difficult to switch off in terms of our mental health and well-being when we leave our workplace and return home. So it is excellent that such important points like this are acknowledged and highlighted. Thank you.
Thank you, Michael. Jane, you?
Thank you. Thank you. Just to echo Councillor Gunn's points, really, but I think it's just fantastic seeing this come to fruition. And I know there's been a lot of work that's gone on in the background, and just a big thank you to you, Mick, and all of the colleagues that you've worked with to get this to where it is, because I think it's a fantastic piece of work and something that we should really be proud of for the county in taking forward. Thank you, Chair.
Thank you, Jane, for them comments. I've got Sharon Cattell.
Thank you, Chair. Hi, Michael. I think this is an excellent initiative and very well supported by, there's a firm evidence base that's behind this, and completely concur with partnership colleagues as well in respect of the diffusion effect that this can have across other sectors, across communities, individuals, their families, etc. So it's an excellent initiative. I just wondered if you could very briefly kind of describe the monitoring that will take place of this. I can see that you've got a well-formed set of strategic objectives and actions there, and if you could just very briefly describe the monitoring in terms of understanding its impact and whether it's gripping or not.
Yes, of course, Sharon. So first and foremost, in terms of monitoring the feedback from local businesses, we will continue to engage or to do a lot of work through Business Durham, who I must add have been excellent in terms of support they've given us in public health for their insight into the operations within this sector. We will, for those clients who do not engage regularly with Business Durham, but who with the North East England Chamber of Commerce, Federation of Small Businesses, we also have a wealth of networks that operate across County Durham. For example, in Bishop and Shildon, in Peterlee, we have the Derwenside Business Network. We have created across the last 18 months some really meaningful collaborations with these organisations, and they welcome public health into their meetings to discuss these issues, so we can gather qualitative feedback from them. What I would like to do is we implemented a range of focus groups in order to get the opinions of our small business and VCS organisations. I would like to run another set of focus groups following implementation of the framework in order to ascertain whether they've seen it, whether there's been any impact. But also in terms of numbers, the maths behind this, we will through our contract management meetings with the hub and EAP providers be looking at how many people are engaging with this. But also we're going to set a baseline in terms of the data from the contract monitoring meetings, and then measure how the programs are taken up and the potential impact of these engagement with these programs going forward. So there will be both a qualitative element of our evaluation and also a quantitative evaluation.
Thank you, Michael. Thank you. I have no other questions, and we're happy to note the recommendation in the report and move on to item 7, which is the County Durham and Darton System Winter Plan. And Sue Jakes will present this item this morning.
Thank you, Chair. I'm Sue Jakes. I'm Chief Exec at County Durham and Darlington Foundation Trust, and also co-chair with Stuart Findlay, the local area delivery board. And that board has responsibility for developing a system-wide plan and putting that in place to protect our services each year over winter, and ensuring that we've got robust oversight and escalation arrangements in place. So this report is to provide you with assurance that this is the case. The plan is built on the individual plans of the constituent organisations with a view to doing a couple of things: restoring services that were paused in wave 1 of COVID, managing winter pressures, managing second and any subsequent waves of COVID, and members of this board will be aware that we're bang smack in the middle of wave 2, and ensuring that we have a consistent arrangement for escalation across all agencies, and that that arrangement would also deal with any local outbreaks. As we continue to be in a national major incident, the plan is consistent and forms a major plank of the work that is being undertaken by our local resilience forum that sits across County Durham and Darlington. The plan is dynamic and it incorporates new advice and guidance as and when it's received nationally, and probably two bits of recent advice that's coming out currently is that around the COVID vaccine, which you'll note is not in this plan but is incorporated into the document, which essentially is a live document but was not available at the time this was prepared for you. It also incorporates regional initiatives that we've got. So there's a big plan to expand testing capability in the region, and it links with that. And we've just rolled out Talk Before You Walk, which is encouraging the public to seek advice through contacting their pharmacy, GP or 111 before presenting at urgent care or ED services. The plan sits alongside and is complemented by the work of the Flu Board and the Health Protection Board that's chaired in Durham by Amanda, and the Strategic Command Group that links to the LRF and has been chaired until recently by Terry Collins and now by John Hewitt. We've had the benefit over summer of having our plans peer reviewed. So this has happened on 2 occasions earlier in the year, and there's been some good and helpful advice that's come out from that process. So those bits of advice have been incorporated into the recommendations. So that explains, I hope, how we've prepared it and what it's intended to do. I'll just, if I may, briefly touch on a couple of the key aspects of it. So first of all, its objectives. It's to ensure that as a system, we're able to respond to this winter and recognise that this winter will be exacerbated by the COVID-19 pressures, which also need to be managed. It's looking at optimising the available system capacity to enhance community services and primary care provision and care home support. We're always trying to maintain the highest standards of patient safety and patient experience. We want to sustain the highest possible levels of performance in both the urgent and emergency care services, and have them at similar levels to that we experienced during the first wave of the pandemic. Although members of this board will be aware that we've seen far greater numbers of patients presenting in wave 2 than we had in wave 1. We included in this plan implement the hospital discharge service policy guidance that was issued back in September. We're seeking to minimise ambulance handover delays, to enhance the mental health support both for patients and our local populations. So we've touched on some of that just now. To protect elective care as far as we possibly can, given the accumulation of appointment delays and the numbers of patients waiting for their operation that resulted from COVID wave 1, and that was something that was seen across the country, as you're aware. That we continue to support our key workers, that we promote and ensure high levels of uptake of the flu vaccination and very shortly COVID vaccination, and that we have good facilities to ensure that we can test effectively for COVID. So the way that our plans have developed broadly focuses on 4 main areas. The first is optimising capacity. I won't go through all the detail of that, but it's there in the report for you. To protect our staff and ensure we do have that good uptake of the flu vaccination. That we are effective and safe in our discharge practices, and there's a group that's been set up to oversee that specifically. And importantly, that we ensure that the myriad of support packages, both for staff and patients, for those with long COVID, as we've discussed, for staff that may have developed some level of mental health issue, that they are accessible to all of the staff working in our agencies, and indeed as appropriate to the patients that we are seeing. This year is very different because of COVID, and a lot of the risks that we ordinarily see will naturally be amplified. So we know we're going to have higher levels of staff absence due to COVID test and trace, as well as seasonal flu, and indeed our levels of absence are higher at this point than they were at the same point last year, so the plan takes that into account. We do know that the second wave and any potential waves of COVID will drive up demand, and therefore we need to be able to respond and expand our demand where that's possible. So our plans incorporate that, and some of you will be aware that we, within the hospital acute settings and community settings, have already increased our beds in response to wave 2. We've got the increased incidence of mental health that's arising from both the impact of COVID and the lockdown that we've touched on. Reduced capacity in care homes and the care home sector where that links to COVID. Reduced transport capacity because of the social distancing that's required when we're supporting particularly hospital discharge. We have reduced bed capacity as a result of the need to self-isolate and cohort patients, and quite a complicated way of managing patients through the hospital system so that we avoid any nosocomial infection risk. And that in terms of the regional response, we work very closely with colleagues so that we develop further our response to mutually support patches that are immediately in our vicinity and they us. So I hope that the report brings that all together for you. It's here to provide you with assurance that we have put a plan in place to protect our services over the winter period, to deal with the ordinary winter pressures and those that COVID brings. The increased risks we think are covered off. We've got a high level of assurance. We've got enhanced escalation arrangements for overseeing how these plans are enacted, with Lad B meeting 3 times a week and Gold Command stood up across the various organisations. And we've been working successfully on mutual aid with neighbouring systems. So the plan is there, Chair, for your support.
Thank you, Sue. There are 3 recommendations. I'll ask for the recommendations to be agreed and then open up for questions. Can we agree the recommendations? Thank you. And takes us on to questions. Councillor Gunn, I think you have a question.
Yes, I do have a question, Chair. Thank you. But I would also like to say thank you very much, Sue, for that report. I mean, where do I start to say thank you? I mean, there is no doubt that that frontline services and our NHS trusts are under enormous stress and strain in dealing with everything that is coming at them currently. And I know that we all appreciate everything that is being done. There is so much in this plan. And so I've been picking anything out would be a bit difficult. But I mean, following on from Michael's presentation on good workforce mental health, I'm delighted to see that that is in there. Absolutely essential, given everything that's happening. It is obviously a system with a huge task ahead of you. I tell you what, one thing that did make me smile. And sometimes you need to have a smile, don't you, in all of the things that we're dealing with. And I love the way that you've used talk before you walk. That made me smile. And I think this is sort of like, you know, it's a sort of bit of a strap line, a bit of a something you can put out there that is saying to people, and they will remember it. I used to be a primary teacher, so you know that those things come, that children actually love those things that they can repeat, and you remember those things. So I just wondered how that talk before you walk, because I'll always remember that, is impacting on emergency departments, and are people using the service and taking the advice, because I think it's hugely important to reduce some of the stress and strain that is there. Thank you.
Thank you, Councillor Gunn. I think for us, it's quite early days. So Talk Before You Walk is running right across the North East and North Cumbria, and it's rolled out in our patch sort of only really a matter of a few weeks ago. There is a lot of communication campaigns, so a lot on social media that's asking the public to think and to consider the alternatives of the GP, the pharmacy, before they do present at A&E or urgent care. I think it's fair to say that at the minute we're not really seeing any tangible difference in numbers, but we hope that by working continually with the public, by providing them with the alternatives and being in that continual dialogue, we are able to make clearer to them options that they have and try and relieve some of that hospital pressure where we're able to. But I'd probably have to update you at the Health and Wellbeing Board's next meeting to give the initiative chance to have taken a bit of a hold in our patch.
Thank you, Olwen. Thank you, Sue. It takes me on to Dr. Stuart Finley has a question. Did you want to come in, Stuart?
Yes, thanks, Lucy. I mean, just to add to Sue's comments there, it is very early days for Talk Before You Walk, but we do know that there are a number of people, reasonably large numbers of people that go to an accident and emergency department that really could be better dealt with by their GP or by their local pharmacist. And so if people do go to A&E and they really shouldn't be there, or there are better places for them, we are trying to advise them on the alternatives. Now, we've had some people in working with Sue in the trust from the CCG, and most people just didn't know that those other options were available to them. And so when it's explained to them that they can use e-consult, they can consult with the GP now by email, there are phone calls, there are virtual conversations, there's 111 to go to, there's a local pharmacist to go to. People are actually very pleased to see that there are alternatives, and rather than waiting for some time in A&E and perhaps being there when there are people that are more needy in there, they really do want to explore those other options. But there is a long way to go yet. There's a lot of education and information that we need to get out to the public, but we also need to make sure that when people do come in, that we offer them alternatives even in A&E, so that they in future will use the service in a different way, and probably a more appropriate way to them and for their needs.
Thank you. Really helpful, Stuart. Thank you. Moves us on to item 8, Safeguarding Adults Board update. And this morning we have Heidi Gibson, the business manager, who will present the 5th annual report, which is for our information. Heidi, can I hand over to you?
Thank you, Chair, and thank you for the invitation to present the annual report today on behalf of the local Safeguarding Adults Board Independent Chair, Leslie Jevons. The report's been shared with an opportunity to review, so I intend to just go through some of the highlights from that. The annual report for 1920 gives assurance around the Safeguarding Adults agenda for adults living and residing in County Durham. And additional to the suite this year is a report on a page to accompany the full report and easy read versions. To give some background, the Care Act 2014 placed the Safeguarding Adult Boards upon a statutory footing, and there's a requirement within that Care Act that Safeguarding Adult Boards produce and publicise an annual report, and as alluded to, it is the 5th sub-annual report, and it outlines some of our achievements and challenges over 2019 and 20. It also includes some key data on safeguarding activity based upon the financial year April 19 to March 2020, and that data is subject to publication in line with national returns. The report includes progress against our strategic plan for 2018 at that time, and the priorities that were set out within that plan, which include prevention and early intervention, user care, voice and awareness raising, also performance, quality and governance, and safeguarding adult reviews. In light of the coronavirus pandemic, the statutory partners also met with frequency in March and onwards to produce a 12 to 18 month COVID recovery plan, and that plan has since been finalised and is included within the full sub-annual report as well. The report outlines some of our quantitative and qualitative evidence in line with statutory guidance on focused areas and includes things like key messages and the impact of our board activities. The Safeguarding Adult Review activity has continued to be taken forward and is a statutory requirement under the Care Act placed upon the SAB, and we do have a number of reviews ongoing, including a complex review which was commissioned last year and started in January of this year. It's probably worthy of a note that some Safeguarding Adult Review activity did stand down with the coronavirus pandemic, but it's all since restarted from July onwards and that work continues. The board itself has always had a strong emphasis upon hearing the voice of adults who experience abuse and neglect and receive safeguarding services. And this year we've continued our co-production activity with the development of a peer support booklet called My Safeguarding Story. And we've also outlined within the report the effectiveness of safeguarding responses for adults who've experienced abuse or neglect. And so some of the key data to highlight from the annual report is over 2019-20, we had over 12,000 safeguarding concerns reported, which was an increase of around 12% on the previous year. And the national increase on previous year was around 5.8%. So we've had a significant increase in reported concerns, which could be attributed to a heightened awareness and raised awareness across our communities. Of prevalence, though, in the last year, physical abuse remains to be one of our highest categories of abuse, and that's not uncommon as it's more easily detected. Neglect and acts of omission is our second, and financial abuse the third. And those three categories are in keeping with the national comparator information for 2018-19. In 2019-20, we saw psychological abuse, which is one of the more difficult categories of abuse to detect, rise to about 10%, which made it our fourth most prevalent category in County Durham. And it is assuring in the sense that it is now being detected and being reported. As I say, it's difficult to detect usually. The voice of adults is central in safeguarding, as I've already mentioned, and it's really important that the board has a level of understanding about how well we perform against that and the needs and views of adults who experience abuse and neglect through safeguarding inquiries. And in 2019-20, 97.5% of those adults who expressed a view said that their desired outcomes had been met, which was an increase on the previous year of 95.4%. The board will continue with its priorities of raising awareness and improving practice, and we've continued to build on our work to embed the practitioner voice. We've carried out workforce practitioner surveys with a steer towards how it feels for them on the front line, which is really important given the current climate as well. And we'll continue to work through our communication and engagement strategy, working with our wider agency stakeholders and partnerships to hear the voice of adults and our local communities. The SAB maintains its link to wider work, such as Durham County Council's Adult and Health Services Commission and supporting the provider market. And we have participated within events for providers in 2019 and also had a strong focus on provision within the board development day in January. The SAB continues with its audit activities. We've had a single agency audit and multi-agency audits with peer clinics over the last year, and we've reviewed 6 organisations' assurance reports, and as part of that identified areas to take forward as part of our continued cycle of improvement. The board's also drawn upon the feedback from advocacy provision in County Durham to inform its work over the next year. And we've continued to develop a range of briefings, not least one on self-neglect, Making Safeguarding Personal, which was launched in the last week during Safeguarding Week, and also information to support practitioners related to the coronavirus pandemic and emerging themes around abuse and neglect, such as fraud. We'll continue to support the practitioners with the work around adults who might self-neglect, and we're developing toolkits to support practitioners, and that's also informed by wider work both on a national and local level in relation to homeless deaths, and that work is nearing completion. And the pandemic will continue to challenge us as a board, and particularly health and social care services. But with the new plan in place over the next 18 months, we do intend to reflect upon the current pandemic and what the emerging themes will be, with a strong emphasis upon seeking assurance from our statutory and relevant partners, and also ensuring that our communication and activity continues up to March 2022. We'll continue to focus on the priorities, and one of our priorities moving forward will be the Mental Capacity Act, and also addressing the COVID-19 related issues. With the changes around the amendment to the Mental Capacity Act and what that brings with it in terms of liberty protection safeguards, we'll be looking at the new code of practice when it's issued, and that will be a key area of focus for partners in terms of SAB training and development moving forward. And I'd like to thank you for the opportunity to come and present the findings from the Safeguarding Adults report.
Thank you, Heidi. We do have the recommendation there for the board to note the future work of the SAB and the progress that's been made during 2019-20, and receive the SAB annual reports for information. So can we agree that? And I'll then open it up for questions. Can we agree? Thank you. Right, so no questions? No, I'll move on with item 9, which is the Durham Safeguarding Children's Partnership update, and I believe we have Stephen Winship who's going to present for us this morning in the absence of Dave Pickard.
Morning, Chair. Morning, everyone. My name is Stephen Winship. I'm the Policy and Strategy Officer for the Durham Safeguarding Children Partnership. Firstly, thank you for the opportunity to come this morning to present the Safeguarding Children Partnership Annual Report for 2019-20. And as you mentioned, Chair, apologies for the absence of Dave Pickard, who, if he had been able to attend, would have, and he'd be glad to come to a future meeting of the Health and Wellbeing Board if he could. As you said, I'm here to present the 2019-2020 Dscp Annual Report, and the report itself is available on the Dscp website, as is a young person's version of the report. And I'll mention a little bit more on the young person's report shortly. The Dscp annual report really needs to demonstrate the extent to which the functions of the Durham Safeguarding Children Partnership are set out under the national statutory guidance, which are working together to safeguard children, with the latest version being in 2018, and how we have actually fulfilled those expectations. And the guidance does give exactly that guidance as to what needs to be contained in the report. And I mentioned the young person's report, and really that doesn't need to be included as a matter of course, but here in Durham, we've done that because we recognise the importance of reaching out to young people, informing them about what we're doing in terms of our work and our priorities, what successes we might have had. So we really engage with them more and listen to their voices, which I'll come on to a little bit in a few minutes' time. The report itself provides an overview of performance monitoring, as well as providing a summary of things like the restraint that we use in somewhere like the Aycliffe Young People Centre, looks at serious case reviews, child death reviews, and also our multi-agency training provision for the partnership. This actually is the first report of the Dscp after it morphed in April 2019 from board into partnership. And as I said, the statutory duty sits under under legislation and working together to safeguard children. Our primary responsibility, I guess, is to provide a way for the local agencies that have a responsibility in respect of child welfare, of which there's many, and as you all probably know, there's 3 principal statutory partners, and it's about how we can agree how we'll work together to safeguard and promote the welfare of children and ensure that we do that effectively. The report also, I think, describes local governance arrangements and structure of the partnership, and information about the arrangements under the Children and Social Work Act 2017. I think we've tried within the report to set out some multi-agency, what the multi-agency partners have been doing in amongst those effective relationships to protect children and young people from abuse and neglect. It tries to, I think, articulate the progress on key pieces of work in the last year and its impact and our achievements as well. The partnership, when it's set up, I don't know whether people are cited on this, but focused on a vision and values rather than some fairly narrow, perhaps, priorities at that time. And those values and vision are formed around prevention through early intervention, joined up response to service, listening to everybody, including practitioners and children and families, identifying issues and challenging how we respond to incidents and service. It also covers our performance management framework and describes the multi-agency audits that have taken place during the year. To a certain extent, they have been a little bit stifled, I guess, because of COVID, but they still have continued and are now much more focused and set out in the timetable going forward. There's also some detail in the report about the multi-agency training provision, and as members would recognise, I guess, that there's been a real challenge since March about how the partnership and the Dscp business unit, how they support training and how they deliver training going forward. And there's been a significant amount of work in terms of what that training offer looks like, particularly around virtual training and the use of all different types of platforms. The report also articulates some significant work that took place over a year period in the joint targeted area inspection that had taken place at the back end of 2018 into domestic abuse and its impact on children. That had some significant work for the partnership, culminating in a very large action plan, but is now being weaved into business as usual. Albeit I suppose the partnership has these focused areas, we still focus on all the traditional areas of child exploitation, neglect, empowering young people. We're now taking an active role within the Signs of Safety practice framework, which is, as you will appreciate, is becoming the bedrock of what we do, both in terms of the local authority and with our partner agencies. Other things that are commented on in the report for this last year are the innovative introduction, I guess, of the Young People's Commissioner apprentice role, Amy Waits, whose role it's been to engage with children and young people across the county to ensure that their voices are heard, and also to act as a scrutineer for young people against the partnership. For this coming year, it has been a challenge through the early parts of COVID, and we did have, like adults, we did have a restoration plan in place and focused on key areas of work that we were required to carry out. Some things were suspended, like training, but we are now back up and running. This year, we're focusing that the vision and values still have real relevance and are still used to guide the partnership, but we're focusing on some principal areas which are listed in the report around risk assessment and cumulative harm, decision making and the management control on that decision making, domestic abuse and notably around coercion and control as an issue, and the one that's recorded in the report around challenge and escalation really has been merged into one of the other focused areas, and another one that we're looking at which is weaved into our plans is the voice of a child, and I touched on that earlier, I think. the vision of and values of the partnership are around keeping children safe, and the signs of safety practice framework hopefully will help is helping to do that. And I think that's it, Chair.
Thank you, Stephen. Very comprehensive report that you've took us through, and obviously highlighting the voices of the child all the way running through, which is really important. And I'm sure, like other members, we welcome the young person who's taken on that commissioner apprentice role, Amy, which it will engage with our children and young people right across the county to ensure the voices are heard. So we have the recommendation there before you. Can we agree to note the report and the information, please? Is there any questions from any members? No questions.
Chair, Councillor Gunn requested to speak. Councillor Gunn requested to speak.
Sorry, Councillor Gunn.
Thank you, Chair. I mean, it's really a comment, as you would expect, as the Cabinet Member for Children and Young People Services. Safeguarding of children is hugely important, in fact critical, in the role that I have in Durham County Council. So thank you, Stephen, for presenting that report, which is pretty comprehensive, given that this Durham Safeguarding Children's Partnership has not been actually running for that long. So there's been actually a lot of work that has taken place in that period of time, because, as everyone knows, there was the transfer over to the partnership from having a board, and that was via the government recommendations. So working to fulfill all of the objectives has been really a priority. The newly appointed independent chair scrutineer, Dave Peckard, who can't be here today, I have met with him actually since his appointment this year on at least 2 occasions to discuss priorities. So I'm really looking forward to continuing to work with him. And I just sort of I support what Lucy has said about welcoming Amy Waits, and thank you for mentioning that, Stephen, as well, because it is hugely important that we have the voice of our children and young people in terms of our safeguarding work that we do. So I've obviously met with Amy on several occasions as well, and looking forward to working with her again. Thank you, Chair.
Thank you, Councillor Gunn. Any other members wishing to raise anything? No indication. I'll move on with item 10, which is the Health and Wellbeing Board campaigns, and go straight to Amanda, who delivered the presentation.
Thank you, Chair, and thanks, Nicole, for putting the presentation up. I'll run through fairly rapidly some of the key campaigns that partners are working on during autumn. Obviously, we're continuing to work on COVID, and I'll do a little bit more in-depth update on that work in the local outbreak control plan, and that will also run into work on COVID vaccination too. We've heard about mental health this morning. It's one of our key priorities as a board, and there's ongoing work in relation to mental health on our kind of social media channels. A lot of work took place in Mental Health Awareness Week, and then we've got the Family Wellbeing and Safety Resources, which are being formed and shared with partners. So mental health remains a kind of key priority for us as a Health and Wellbeing Board. Thanks, Nicole. We are obviously in the beginning of flu season, and we have a wide spread, both a regional, but we also enhance that with a local campaign, the County Durham Do Your Bit, and we are really rolling that out across County Durham. The council staff campaign launched, as well as obviously the NHS staff campaign, which is really important, and we're having a real push on the infant flu vaccine. I think obviously what we're seeing this year is a real demand, and we heard the announcement yesterday, or was it Monday, of the rollout of the 50 to 64-year-olds, which is positive too. We have seen increased uptake in the over 65s. And I think, again, what we've seen is that our local services, primary care, pharmacy, have had to work in a very different and innovative way to ensure that we can keep that uptake as high as possible. One of the areas that we are finding is need an increased focus is people who are have a respiratory condition. So we're doing some additional communications in terms of people who have a respiratory condition such as asthma, to really encourage them to get their flu vaccination this year. So that will continue, and our hope is that flu season will mirror the Australian flu season, which completely flatlined during their winter season last year, with the additional benefit that the focus on hand washing and respiratory hygiene is having. So let's hope that follows suit in County Durham. Thanks, Nicole. Continued work on our smoking, which was Stoptober, and you can see the really bright poster there, the Quit Smoking and Breathe campaign. And we continue to try and reduce that gap in inequalities in terms of smoking. Fresh North East, obviously, our kind of commissioned area of work, and the video that's a link in there really kind of features as part of our overall campaign. So ongoing work as ever in relation to smoking. Thanks, Nicole. Alcohol, and I think obviously what we've found during the pandemic is that actually people are now drinking at high risk levels as what they were in February, and it's clear that alcohol is being used as that coping mechanism for COVID, with obviously impacts both short and long term in terms of health and wider economic and social impacts of that. So balance, again, similar to our regional tobacco, but for alcohol, and this was supported really joined up campaign with NHS partners to a campaign from the 11th of November through to the 8th of December, highlighting that alcohol is not the answer, with some key messages in relation to kind of cutting back and helps that physical and mental health and wider health impacts and social impacts as well. So it's really an ask for partners to continue to share that campaign as it runs through to the 8th of December. So they're the kind of key campaigns that we are running at the moment. Obviously, as the board, we try and keep them focused so that partners can really do as much as they can to support those campaigns. And I'll stop there, Chair. Thank you.
Thank you, Amanda. Thanks for the presentation. If we could ask members around the partnership and encourage partners to share the information, so we're getting the same information out and it's accurate, and it's been circulated across the social media platforms. So if members and partners can do that, that would be really good. With that, I thank you, Amanda, and I'll move on to item 11, which is the COVID Community Champions Programme. Quite an exciting initiative for us, and obviously we've been busy recruiting people to this initiative, and people have put themselves forward, which is excellent from our communities. Very important that the community have got some support, and also we have training in place around this initiative, but a sense of ownership for our communities. So this morning I'm delighted to launch the COVID-19 Community Champions Programme at the Health and Wellbeing Board meeting today. Throughout the crisis, we've supported communities a number of different ways, including keeping up to date with the latest information and guidance, and this programme builds on that, empowering our communities to take action in local areas. The Community Champion Programme will train, support and upskill people with the relevant information and messages for them to share within their own areas. It is really important that these messages will come from local people in our communities, and they are given reliable, clear, consistent messages in a timely way. The community champions will become the trusted voice within their communities. At the last Health and Wellbeing Board meeting, we had a presentation on the approach to wellbeing, and the Community Champions programme builds on these wellbeing principles to help empower communities to build local assets and resilience. Working with our residents, we will help to ensure services and interventions are centred around the people who need them. We have a dedicated webpage to host the programme and a specific email address. Details can be found on the Council's website. Anyone who is interested in the programme is encouraged to visit the webpage and sign up, and there is also a toolkit available online. I would strongly encourage Health and Wellbeing Board members to share the details of the programme using all available challenge, as well as helping to recruit champions. A press release is being developed to share this positive news far and wide. Amanda Healy will provide further information on the programme within her presentation. And with that, I formally launched the Community Champions programme. Amanda?
Yeah, thank you, Lucy. And obviously we're delighted to see the Community Champions programme launch. And as you've said there, and we recruited some of the champions as we went through the AAP events. And when I give the presentation now in terms of the local outbreak control plan, there's a little bit more detail about the Community Champions programme, which I will go into as we go through that presentation. So, Chair, if you're comfortable, I'll move on to the next agenda item, if that's okay, and I'll pick up the Community Champions detail as part of that presentation.
That's lovely, Amanda. Thank you.
So, colleagues, thank you, Nicole. So this presentation is to give an update from September to November of the Health Protection Assurance Board and our work on COVID. I think, as I say, I'm certainly delighted, as I'm sure partners will be, to see the launch of the Community Champions, because we have heard a lot about pandemic fatigue. We're going into winter. We've heard from Sue this morning of the winter plan and the challenges of health and care colleagues have in terms of both COVID, but keeping existing services going, and the pressure of winter and a vaccine on the horizon. So I think everything that we can do as partners and with our local communities is going to be really important during these coming months. And I think from the beginning of the pandemic, what we've tried to do is to ensure that we give reliable information. And so this is our public dashboard. People can Google Durham Insights COVID and it will come up. It's a 10-page dashboard which includes information about cases, about testing, about information right down to lower to middle super output area, hospital admissions, and obviously sadly deaths and within County Durham. It also enables us to compare ourselves with other parts of the North East and also nationally, and looks at the changes in rates of positive cases over time. And certainly what we've seen from our last board to this is that at the beginning of September, our rates started to increase, and the seven leaders of the local authorities, 7 local authorities in the north of North East, actually sought restrictions from government at an early stage because of those rapidly increasing rates. And we talked about that at the last board when we were managing specific outbreaks, and we moved beyond that to much more widespread community transmission. Our rates, you can see towards the end of September and October, started to plateau. However, our rates were plateauing at still quite a high rate, and obviously then we saw them increase again, and then national restrictions came into bear on the 5th of November, which will take us through to the 2nd of December to obviously to next week. Our current position in terms of our rate in County Durham, that was of the 9th of November, it will be updated today. Our current rate is now 312 and we're actually seeing a real decrease. So our 7-day rate has actually seen a decrease of 95 at 0.8 per 100,000, and this has been reflected in other local authorities across the North East as well. So we do hope that that is a continued decrease. What we don't know, and what we won't know until later in the week, is which tier of intervention that will leave us in, and I'll come back to that towards the end of the presentation. But all of this data forms part of the local outbreak control plan, and ensures that we can guide our prevention and our response plans as rapidly as possible by having that data. Thanks, Nicole. So a quick update on the work of the Health Protection Assurance Board, and the board's now chaired by Jane Robinson, which is great, because I think that gives corporate and kind of partnership oversight to the work, and has a range of partners working on kind of wraparound outbreaks within key settings. But we have obviously used some of our kind of local outbreak control funding for a dedicated team. At the beginning of September, what we also found was, because of the way NHS Test and Trace was working, and that not all contacts were being reached, many contacts and cases were being escalated to Public Health England's Health Protection team, and then they are being passed to the local authority. So we now have a team, an outbreak control team, working really closely with other departments across the council and other agencies to manage cases and small outbreaks, and that includes fantastic work within our education department, dedicated work within Durham University, but also our environmental health teams, really actively working alongside health colleagues managing outbreaks, and that has been quite a shift in practice. We've had improved data analysis and sharing data, particularly with healthcare colleagues presenting at the Health Protection Assurance Board, keeping up to date on what's happening within healthcare in terms of any transmission there. We've really followed up on common exposures in workplace outbreaks, with environmental health teams taking a lead in that, and ensuring and looking at any linkages. And as I say, there's been a real focus on the university and the university setting, following quite a large outbreak once students returned to County Durham at the end of September, beginning of October. Additional funding has also been provided to increase community protection, and there is a compliance cell that's now been established under the Local Resilience Forum, and I think, again, probably in readiness for restrictions easing next week, our community protection and police colleagues will be looking at compliance issues. And certainly before and during our earlier restrictions, there was some very proactive work done with businesses where enforcement had to take place. However, the majority of that work is actually working with businesses. It was with the hospitality sector, local businesses, to ensure that they were COVID secure. So a lot of work taking place there, and a huge amount of work on comms and engagement. And I will come back to that in a little bit more detail. Thanks, Nicole. So our work across the Health Protection Assurance Board and that outbreak control team work around the kind of 7 key settings, which obviously include our community, our care homes, universities, schools, prisons, vulnerable populations, and we've got teams of people who are working in relation to those outbreaks. And this information is slightly out of date now, because of when we obviously have to put papers forward for the board, and as I said, certainly the university have now moved from managing a significant outbreak to planning their students for Christmas, and for students returning home at Christmas. But also we've been working with key workplaces of concern. Testing remains a kind of key focus of the Health Protection Assurance Board, and I think what we've seen is that we have testing in place, whole home testing for our care homes, for NHS staff. We've got good access to mobile testing and local testing sites now across County Durham. So, and we will see an increase in the access to testing with increased funding through the NHS. However, what is obviously very much in the here and now is the mass or rapid community testing, which was announced yesterday by government. And across the North East and locally, we are looking at that in relation to some of our vulnerable populations, but also what is the potential of rapid community testing and the use of the lateral flow tests to support people. The Durham University are utilising that with their students at the moment, and we're learning from their pilot to see what else could be used at a Durham County level. I think usually, and obviously this board oversees our wider health protection work, we would usually have an outbreak of something, then sit and learn some lessons and review good practice. What we obviously have to do in this situation is learn lessons rapidly as we go through. So when we have been managing outbreaks, be that in one of our care homes, be it the university, be it a workplace, we're rapidly learning lessons, and we include that on every agenda and then feed that back into the Health and Wellbeing Board, the Health Protection Assurance Board, so it can be shared with other settings. So, you know, communication is a key one in terms of with local residents in relation to that infection prevention control. Things like car sharing, which we've found has been taking place, or people actually mixing outside of work but not in the workplace setting. So that's been a rapid way of kind of learning and sharing that practice. And obviously we work up to the regional oversight group, and also we've been part of a bid to the Department of Health and Social Care for a regional COVID hub and NHS test and trace, which is still being considered. Thanks, Nicole. During the sorry, if you can pop it on the next slide, that's lovely, thank you. Obviously, during this kind of second wave, apologies, Nicole, I jumped ahead there. So could you pop it back to the County Durham Together hub? That's lovely, thanks. So our community hub had to be, which is we had kind of set quite quietly across the summer period, and I think probably some of our colleagues in the community and voluntary sector were thinking about their next steps, had to be re-stood up really quickly again. And again, I think what is really clear in County Durham is just that very rapid response, both from our statutory and our voluntary sector and community organisations, to be able to support residents who were extremely clinically extremely vulnerable. But I think one of the things that's really strong in County Durham is how we can support people with wider multiple social vulnerabilities. And I think what we're finding this time is more people are coming forward from a financial perspective, and obviously Councillor Surtees and the Poverty Action Plan are looking at how we obviously mitigate some of those wider financial vulnerabilities that we are finding for our local residents. But that continued need for food, essential supplies is still there, and obviously work in relation to isolation and loneliness through the kind of Chat Together programme. So really comprehensive, can only work in partnership with others, but able to stand back up really, really quickly. Thanks, Nicole. So in terms of communication, I think what has been really important is some of the work we've done ongoing. So some of the examples are there, and then a targeted response to specific outbreaks. However, I think at this point, what we know is that people are tired. You've heard that pandemic fatigue, and what has happened across the local authorities, 7 group of local authorities, there has been some insight work carried out to really understand what are the barriers for people being able to self-isolate if they test positive. What are the things that will motivate people in terms of restrictions or adhering to the basics of hands, face, space? And that work is coming to fruition and will be then turned into a campaign and an engagement piece of work. And it links very closely to the Community Champions work that Councillor Hovers has just launched. So that is quite a major piece of work that will help us through this next phase, and is very much about taking our communities with us. Thanks, Nicole. And underpinning it all, and we heard obviously from Mick, and obviously Sue referred to it in her report, to how important mental health and the impact of COVID on mental health, children and young people. So that ongoing work with children and young people, obviously finances, employment, adults, exacerbation of existing conditions, and for older people, social isolation, that possibly a loss of sense of purpose. So some of our system-wide work is just down the right-hand side of the slide in relation to ongoing work with children in terms of our Anna Freud work, the mental health framework for schools, the suicide prevention, and dementia-friendly communities, which is ongoing. And every single service has had to adapt to COVID to work in a kind of COVID safe way. But mental health remains obviously such an important kind of programme of work for us. And then in terms of the community champions, so thanks Nicole, if you can pop that on. Obviously, as Councillor Hovers has just launched, we're recruiting COVID champions. Part of that well-being and taking our communities with us, and actually we know that people share information in different ways with different people. By telling people, it doesn't make people do and act in certain ways. We have to have that as trusted voice in local communities, and that will help to keep our communities safe by promoting those key messages, giving us feedback about what may work. You know, we've had our Taylor family, but actually this is about our real, you know, residents, what is important to them, and then we can translate that back into our communication and engagement work and ensure that they can continue that huge contribution that they have made. And then there's just a little bit more detail on the next slide about the Community Champions programmes. So what we hope is almost a kind of social movement. So one champion will start to share information within the 20 and will keep people up to date with up-to-date information, which changes rapidly, as you can imagine. And we hope that will kind of be that kind of spread, that ripple effect across local communities, and people can be kind of community champion businesses to really make that difference in a really simple way. And then I think just to round off before we go on to the questions is really the kind of key focus of work going forward from the Health Protection Assurance Board. So we've obviously got this huge piece of work around taking our communities with us. Test and trace remains a real priority, and ensuring, particularly as our rate of cases come down and if we're coming out of restrictions, the ability to test, trace and isolate is so important. The implementation of the rapid community testing in a way that is really important to us locally. Ongoing protection of our vulnerable. That could be our clinically extremely vulnerable. It's obviously our residents within care homes and in the care sector, and then obviously very rapidly on the horizon, and obviously with colleagues in the NHS leading this, is the vaccine and the implementation of the COVID vaccine programme. So they'll be the areas that will be focused on, both from us locally and also join up at a regional level. So Chair, I will stop there in terms of the presentation, and then I know we've got questions from members of the public.
Thanks, Amanda. Thank you, Amanda. I think it's important to say that information does change quite quickly. So some of them, the beginning of the slides, and then figures and facts may have changed. So it's important to note that. We have a number of questions. So the first one, which I have down on my list, is John Pearce in relation to additional support around vulnerable young people. So if I could ask John Pearce to read the question and answer it, please.
Yeah, thanks, Chair. So the question was, how have our local schools responded to any COVID-19 outbreaks, and what additional support is given to our vulnerable young people to give them the best possible chance in their future? So as Amanda outlined in one of the earlier presentations, schools are one of the key groups in terms of targets for outbreak management and ways of working. Our schools have had a huge range of challenges through since the COVID outbreak and through the initial lockdown period, and then since reopening in September. And I'd want to start by thanking everybody who's been involved across our schools, staff, leadership in schools, who have done an amazing job over that period of time to ensure that our children and young people have had some of those risks mitigated for them, and they've really stepped up. They've been really well supported through public health and through local authority education officers and the support services that we have in place. But our schools continue to do an excellent job and have shown a massive amount of resilience through some really challenging times. To ensure they're enabled to provide COVID secure environments for children, particularly whilst they remained open during the spring and summer for our most vulnerable children and also for the children of key workers, and then as the return to school in September was prepared for, there was a whole range of work done to plan for that and to provide those secure environments. That involved risk assessment. It involved taking a lot of the national guidance, often at extremely short notice, and translating that into what it meant on a school-by-school basis. All of our schools are different in terms of their physical infrastructure, their size, the age groups that they work with. So it was really important that they took that individualised approach to risk assessment, whilst taking learning from best practice and the support that was given. And they did that, extremely effectively. We had some information based on the first half term of this academic year, so from the beginning of September through until the end of October. And whilst we did have a number of positive cases in schools, as a proportion of population, it was really low. So for that 8-week period, it was 0.3% of our school age population who tested positive. So 250 cases out of 77,500 pupils. So if you look at the correlation between community transmission, clearly the work that was put in place in schools to provide that environment had a real impact to try and ensure that children stayed in school. Every time a case was identified, schools have had really robust decision making. They've worked with the public health links and with their school education service links to understand the risks associated with the case, and to ensure that the appropriate scale and a proportionate response to the case has been taken to minimise any disruption on education, and that's continued to work extremely well. Schools have also provided a range of support materials for pupils as they've been self-isolating, and that's included things like providing vouchers and food parcels for those children who are eligible for free school meals, ensuring that as much access to remote learning could be put in place to mitigate the impact. I think we recognise that there's been really significant disruption on education, and remote learning, whilst far from ideal, has helped to mitigate that to a certain extent. And the work our schools have done to continue to support children educating whilst they may have been self-isolating or out of school for other reasons, I think has worked well and certainly started to mitigate that risk. They've also continued to update the risk assessments as new guidance has emerged and as learning has emerged. So I think learning from some of the outbreak control processes has been really valuable to support schools to continue that learning as we go forward. In terms of the support specifically around vulnerable young people, a range of additional services have been put in place. So specific educational resources were developed for our children with special educational needs and disabilities and for our children looked after. That provision had some absolutely targeted support and signposting to services who could provide things such as emotional health and wellbeing support. Many of our services through this period have also adapted the way in which they deliver services, so they're able to target support far more for those families who needed that additional support, and have been much more flexible in the way in which they've developed that support, and that's worked extremely well. Touched a bit on the home learning facilities. We have provided access to equipment for those who've required it, and particularly our vulnerable children. So we've had about 1,500 devices for our children who've been identified across the county, and in addition to that, schools have also been able to access remote learning facilities and IT equipment, although there's been some challenges in more recent times about some of the access to equipment that have been promised nationally, and we've been picking that up with the Department for Education to make sure that some of the delays in providing that equipment can be expedited. We've also, as a council, put in place financial support for families, including things like the Back to School Fund for targeted support for those families that require additional support. And we've also looked at key transition points, so particularly transition from year 11 into post-16 provision and from transition from primary through into secondary. And our educational psychology team have developed a range of resources to support that transition, really targeting it at some of our vulnerable groups of children to make sure that they have the support that's required. So there's been a whole range of activity that's been put in place. We recognise that it hasn't been able to mitigate all of the impact, and we completely understand that will continue to be a challenge over the remainder of this academic year. But I think it's fair to say that schools and the support services that have worked around them have absolutely gone over and beyond what could have been expected in terms of how they support our children and young people to mitigate some of that risk.
Thanks, John. Quite a very comprehensive response there. Takes us on to the second question, which is from a local resident. Amanda, I think you were going to do this one.
Yeah, thank you, Chair. The question from the local resident was in relation to COVID-19 is widening the health inequalities gap in County Durham between the least and the most deprived areas. What are partners doing in support of those areas greatest in need? And I think obviously the North East has seen and already had, real gaps in terms of health inequalities, and that was reflected in County Durham. Obviously, we have that as one of our kind of key priorities in our joint health and wellbeing strategy. And I think obviously the pandemic has, exacerbated some of those health inequalities. We have obviously been very proactive, I think, as a partnership, and carried out as part of the initial recovery programme quite a detailed health impact assessment, which highlighted some key areas of focus, including mental health, which we've spoke about this morning, but also the impact of poverty, for example. And the Poverty Action Steering Group will be really focusing on those recommendations from the health impact assessment, so that we can try and mitigate the increased risks of poverty and child poverty in particular. I think we've also seen during the pandemic key services. Obviously, John's mentioned some really clear examples from schools there, but we have also seen some really good examples from other services. We've talked about the community, but services such as our drug and alcohol service going to online assessments. We also increased the level of funding into our domestic abuse services, because we really recognise that people, particularly during the first lockdown, that may increase the issue of domestic abuse. So we increased support for those services. So trying to do some preventative work, as well as now looking at the mitigations of those health inequalities. Our partners, obviously within the NHS, are now trying to look at existing services that had to stop in that first wave and catch up, and will be looking at the impact of programmes of elective surgery, of screening, for example. And we had a North East conference about 2 weeks ago, which focused on health inequalities, and how the underpinning inequalities are exacerbated in a pandemic situation, and ensuring that we've focused our attention on those who are most at risk from the virus, but also the impact of the virus is a key part of our work going forwards. And we'll obviously take that work into our review of the joint health and wellbeing strategy as well, which, as you know, was for a year, and we'll be refreshing that. So we'll really focus on those inequalities and wider social inequalities going forwards, Chair.
Thank you, Amanda. I may come back to you, Amanda. The next question's around track and trace, and what can be done to provide clarity for County Durham residents regarding when and to specifically isolate, and for how long. You might be best placed to answer that one.
Thank you, Chair. I'm sure there's a few people around the table, the board, who've been answering this question. But there is a lot of confusing information, I think, about test and trace and isolate, and when somebody's in contact with someone else. And I think we do try and keep that information up to date. And we've used the data dashboard this morning, and wider information about COVID and around NHS test and trace is on that dashboard too. But I think just probably a few key points is obviously what we're still advising people is if they do have symptoms, so high temperature, new continuous cough, or loss of sense of smell or taste, then the immediate thing to do is to self-isolate and to book a test. And all of the members of your household must also self-isolate. If that test comes back negative, household and yourself can stop isolating. If it's positive, you need to self-isolate for 10 days from the onset of your symptoms, and your household need to self-isolate for 14 days. So that's the difference between yourself and your household. Obviously, the other way that you might find out is about being contacted as a contact of someone who's tested positive. And if you are contacted, then you need to actually self-isolate from the date that they will provide through NHS Test and Trace, and only get tested if you then have symptoms. So that information is on social media, it's on our website, it's in national information. And again, what we hope is that our community champions will be able to really relay that information to people locally, because again, we recognise that sometimes it changes and gets updated, but that they can be our kind of conduits into local community. So I hope that's helpful. It's also the information is held on our County Durham Together in the community hub, and they answer queries about that to local residents too. Thanks, Amanda. Moves us on to the question 4. This is around the NHS system coping with the increase in COVID cases. I think, Sue, if you could do this one for us, please.
Thanks, Chair. And I think I've probably covered some aspects of this in my earlier paper, but I think we have currently got more COVID than we had in wave 1 in the system. I think that the NHS and care system are working really well together in that integrated fashion that we've been promoting now for a number of years to support patients and residents and each other with the additional demands that places on our system. I think that unlike in wave 1, as well as those higher numbers, we've also got more people attending for emergency and urgent care, so that puts greater pressure on the system still. And as I referred to earlier, we're delighted that all services are stood back up and we are able to undertake what we committed to in terms of the elective programme. I think it's important that we manage this really tightly. We do as much elective activity as we can for the reasons that Amanda has stated, and it's being managed exceptionally tightly on a daily basis, because we do know some patients for non-urgent operations, for example, have had to wait much longer than they would ordinarily. When we look across the North East and North Cumbria and wider across England, we look to be performing reasonably well compared with others who were in the pack, if you like, and clearly the issues that COVID has brought us affected all NHS systems in a similar way. If I could just give another plug for the way we're trying to ensure that we deliver the safest, most effective services, but we are encouraging people to hashtag do their bit, do your bit, and use services appropriately, and think of accessing pharmacy, GP or 111 first, as I described when presenting the winter planning paper. We've got, as you would imagine, many measures that we've put in place to safeguard patients in our care at this point. So they range from adaptations we've made to the hospital environment, which is largely segregated into COVID and non-COVID specific areas, the protection of the elective surgery that I've just touched on, and using technology to help us maintain our outpatient programme by having some of that delivered virtually. We also review anybody on any of our waiting lists for non-urgent operations to make sure that their condition isn't deteriorating and that their priority is, if that does happen, that their priority is reassessed. in the winter plan, I touched on the fact that we're lucky because we've got a lot of good community estate and we're fully utilising that. So we've got additional capacity open at Bishop Auckland, Chester Street, Shotley Bridge. Basically, all our community hospitals are really playing a fantastic part in dealing with the increased pressure that COVID's bringing us in wave 1. So in summary, I think staff are working really hard. They're working in a really integrated way. As Councillor Gunn said before, they should be applauded for the way that they've really dug in this difficult circumstance. Thank you.
Thank you, Sue. Takes us to the last question, and it's around the clinical extremely vulnerable being supportive. Faisal, is Faisal with us?
Thank you, Councillor Hovels. Faisal Jasser, County Durham Clinical Commissioning Group. It's a question from a local resident. How are those people who were previously shielded and who were classed as clinically vulnerable being supported? We are focusing on our communities helping each other in the first instance, and we saw this huge neighbourly effort in wave 1, and clearly that has continued in wave 2. We also know the significant impact our voluntary, community and faith sector provide within local communities, helping with food, loneliness and money worries. And of course, today's meeting has reflected on a lot of these issues, Chair. The Council's area action partnerships have injected significant amounts of money into local communities to enable those communities to respond during the pandemic and meet the needs of the most vulnerable. And again, we've heard of that in the meeting. Those who are categorized as clinically extremely vulnerable will be patients within the NHS, and we continue to strongly advise they remain in contact with their clinicians and maintain all appointments. The social prescribing link workers who are aligned to general practice currently have an active list which includes those identified as clinically vulnerable. Practices also contact patients regarding their welfare and continue to undertake home visits where appropriate. We have written out to all clinically extremely vulnerable locally and have advised how and where to seek help. In our Director of Public Health presentation, she referenced the County Durham Together Community Hub, but just as a reminder, this is our local place to phone or email if people are unsure of what support is out there, and we can work with people to find the right solution for them, be it essential supplies, practical support, low-level mental health concerns, loneliness, or money worries. Finally, Chairman, the County Durham Together Hub is in contact with all the right agencies to signpost and guide people towards the most appropriate support. Thank you.
Thank you, Faisal. Thank you very much. That concludes the questions. I'll go on to item 13, which is any other business. I haven't been notified of any other business, but as Chair of the Health and Wellbeing Board, I would like to place on record my thanks to all the partners, organisations around the table and those that are delivering the frontline services on the ground. Our thanks and appreciation, and doing a very good job. Well done to everybody, and thank you in difficult, extreme circumstances, which we are very much aware of. I would like to thank members of the public and the media who have watched this meeting. And just to note before we close, when the broadcast comes to an end, that's when we'll be leaving the meeting. So with that, I formally close today's Health and Wellbeing Board and say thank you.